Hello viewers, I am Dr. Roviul. I work as a lecturer in pathology in a medical college hospital, and I am making this video for my students and also for you. Hope someone finds this helpful. Today's topic is on liver cirrhosis part 1. This video will contain the definition of liver cirrhosis followed by brief discussion about its classification and pathogenesis. Then in the second part of this series that I will hopefully upload within a week, we will finish our discussion by talking about the morphology, clinical features, and management of this disease. Okay, so a lot of topics, so let's begin. First question, what is liver cirrhosis? How can we define liver cirrhosis? Now, before telling you the definition of liver cirrhosis, I would like to tell you some features of liver cirrhosis that will help you in understanding the definition. So the first thing that you have to remember is that liver cirrhosis is a condition that is affecting the entire liver. The second thing that you have to remember is that in liver cirrhosis, the normal lobular architecture of the liver is lost and it is replaced by regenerative parenchymal nodules that are separated from each other by irregular bands of fibrosis. Now let me explain. Recall from your histology classes, we had seen that liver is divided into numerous lobules and they measure between 1 to 2 millimeters in diameter. And I have also drawn a simplified hepatic lobule in the whiteboard, as you can see. So let's first focus on this image. So this is a simplified image of a hepatic lobule. Note that I have drawn this image in a hexagonal shape for simplicity, but always remember, in reality, in human liver, the shape of these hepatic lobules is in fact quite variable. Note that each hepatic lobule is oriented around a central vein. Okay, so this is a central vein. It is also called the terminal hepatic vein. We can also see that in the periphery of a hepatic lobule, there are portal tracts. So here is one portal tract, here is another portal tract, and we can also see another one here. And the examiners are very fond of asking about the components of each portal tract. Always remember, each portal tract will contain hepatic artery that I have drawn in red color. So this is the hepatic artery. It will also contain the hepatic portal vein that I have drawn in blue color. So this is the hepatic portal vein, and it will also contain bile duct that I have drawn in green color. Also remember that each portal tract will also contain lymphatic vessels. So this is the normal architecture of a hepatic lobule. And in liver cirrhosis, this lobular architecture is lost and it is replaced by regenerative parenchymal nodules. The next feature that we have to remember is that in a liver cirrhosis, there will be variable degree of vascular shunting. So now that we have talked about the features of liver cirrhosis, now we are ready to define liver cirrhosis. Okay, I hope you are still with me. You didn't run away just like my students do when I try to teach them definitions of pathology. I even have to show them teddy bear or cartoon characters to keep them calm. So look, I am also showing you a minion. So look at the minion, don't run away, because if you had listened to the features of liver cirrhosis that I have just mentioned, I'm sure you will understand the definition clearly. Okay, so according to your textbook, liver cirrhosis can be defined as a condition marked by diffuse transformation of the entire liver into regenerative parenchymal nodules, surrounded by fibrous bands and variable degree of vascular shunting. And always remember, regarding the vascular shunting, often we will see portosystemic shunting when we are talking about liver cirrhosis. So now that we have talked about the features of liver cirrhosis and also defined liver cirrhosis, now we will move on and talk about the classification of liver cirrhosis. Now always remember, we can classify liver cirrhosis in a variety of ways. According to morphology, it can be micronodular, macronodular, and mixed. Now, what is the micronodular type of liver cirrhosis? Here, the diameter of the nodules will be less than 3 mm. In case of macronodular liver cirrhosis, the diameter of the nodules will be more than 3 mm. And you have guessed it, in case of mixed type, there will be presence of both micro and macro nodules in the liver at the same time. Okay, so that is the mixed variety of liver cirrhosis. Again, we can classify them according to their activity. It can be active or it can be inactive. Liver cirrhosis is considered active when there is continuing hepatocyte necrosis and when there is also presence of inflammation. At the same way, liver cirrhosis is considered inactive when there is no continuing hepatocyte necrosis and when there is no evidence of inflammation. Again, we can classify liver cirrhosis according to etiology, and I have also written those types in the whiteboard. So according to etiology, liver cirrhosis can be alcoholic cirrhosis, post-necrotic cirrhosis, biliary cirrhosis, pigment cirrhosis, cirrhosis in Wilson's disease, cirrhosis in alpha-1 antitrypsin deficiency, cardiac cirrhosis, cirrhosis that is happening in autoimmune hepatitis, cryptogenic cirrhosis, etc. So now we will talk briefly about these various types one by one. So first we will talk about alcoholic cirrhosis. Now always remember, chronic alcohol consumption is the leading cause of liver cirrhosis. 60 to 70% cases of liver cirrhosis are due to such chronic alcohol abuse. Now, alcoholic liver cirrhosis is also known as Laennec cirrhosis, that is named after the person who had introduced the term cirrhosis in 1818. Alcoholic liver cirrhosis is also called Hobnail cirrhosis, nutritional cirrhosis, diffuse cirrhosis, etc. And the examiners are very fond of asking, what do you mean by hobnail cirrhosis? In order to understand that, first we have to know what a hobnail is. Now always remember, a hobnail is a short nail with a broad head. This type of nails are used in the sole of boots to increase the durability of boots. For example, here I have drawn a pair of boots, and notice on the sole of the boots we can see hobnails. Okay, now compare these with this image. This is a very simple diagrammatic image of a liver, and here we have alcoholic liver cirrhosis. And a lot of micronodules are seen throughout the liver, and they are almost of equal size, so there is very little variation in their size, and they are studded on the surface of the liver as well, just like hobnails. So that's why alcoholic liver cirrhosis is also called hobnail cirrhosis, and this explanation is very high yield for your examination. Now I have a separate video entirely on alcoholic liver disease, so you can also look into that video after watching this video for more information regarding alcoholic liver disease and alcoholic cirrhosis. So now we will talk about post-necrotic cirrhosis. Now, post-necrotic cirrhosis most commonly occurs following viral hepatitis. Okay, so always remember that the most important cause for post-necrotic cirrhosis is viral hepatitis. It can also occur due to certain drugs and chemicals, for example, acetaminophen, carbon tetrachloride, phosphorus, mushroom toxin. All these things can also lead to post-necrotic cirrhosis. Moving on to biliary cirrhosis, this type of cirrhosis may occur following intrahepatic or extrahepatic cholestasis. Now, you may be asking me, Dr. Robiul, what is cholestasis? Always remember, cholestasis is a condition where bile cannot flow from the liver to the duodenum. Now, biliary cirrhosis can be further classified into primary biliary cirrhosis and secondary biliary cirrhosis. In primary biliary cirrhosis, there will be destruction of intrahepatic bile ducts due to unknown causes. Okay, so in primary biliary cirrhosis, the exact cause is unknown, but it is resulting in destruction of intrahepatic bile ducts, and that is resulting in liver cirrhosis development in the long run. Moving on to secondary biliary cirrhosis, in this type of cirrhosis, liver cirrhosis is occurring as a result of prolonged mechanical obstruction in the extrahepatic bile ducts. The next type of cirrhosis was pigment cirrhosis. This type of liver cirrhosis may occur in hemochromatosis. Now, what is hemochromatosis? It is a condition in which there is excessive accumulation of iron in the tissues. Due to excess accumulation of iron in certain tissues, there will be tissue damage, and also there will be functional insufficiency. The organs commonly involved will include the liver, the pancreas, heart, pituitary gland, etc. And often we will see a triad of clinical features in a patient with hemochromatosis. So obviously there will be liver cirrhosis due to involvement of liver, due to excess accumulation of iron in the liver. At the same time, these patients may also have diabetes due to involvement of the pancreas. And they will also have skin pigmentation. And in your textbook, you will also see a term that is called bronze diabetes, and that is resulting in hemochromatosis. So there is diabetes, and also there is skin pigmentation. And skin pigmentation along with diabetes that we see in hemochromatosis is also called bronze diabetes. Moving on to the next type of cirrhosis, and that was cirrhosis in Wilson's disease. Now, Wilson's disease is also known as hepatolenticular degeneration. In this type of disease, there is copper metabolism abnormality. Okay, so this is an autosomal recessive disorder in which there is abnormal copper metabolism that will lead to toxic accumulation of copper in certain tissue, mainly in the liver, in the brain, and in the eye. So as a result of excess copper accumulation in the liver, there will be liver cirrhosis. At the same time, due to excess accumulation of copper in the brain, there may be bilateral basal ganglia degeneration. And a very important thing for your exam is in the eye. In the eyes of a patient with Wilson's disease, there will be greenish brown pigmentation around the corners or around the periphery of the cornea, and it will form a ring, and that is called Kaiser-Fleischer ring, and that is happening due to excess accumulation of copper. So that was in short about Wilson's disease, and as we are seeing here, liver cirrhosis may also occur in Wilson's disease too. The next type was liver cirrhosis in alpha-1 antitrypsin deficiency. Now always remember, alpha-1 antitrypsin is a glycoprotein that is produced inside the rough endoplasmic reticulum of hepatocytes. Its function is to act as a potent protease inhibitor. Alpha-1 antitrypsin deficiency is an autosomal recessive disorder. In this disorder, there is defective protein folding due to gene mutation. As a result, abnormal proteins are produced inside the hepatocyte and they get stuck inside the hepatocyte. So what will the hepatocyte do now with this burden of abnormal protein? It will die by apoptosis. So there will be apoptosis of the hepatocytes that contained the abnormal protein. And following apoptosis, there will be also compensatory hyperplasia. And this cycle of hepatocyte death and compensatory hyperplasia may lead to liver cirrhosis in the long run. Now also remember, alpha-1 antitrypsin has a very important role in the lungs, where it acts as an antiprotease and counters the action of elastase. So whenever there is alpha-1 antitrypsin deficiency, that will also have an effect in the lungs, and that will result in development of emphysema. What is emphysema? Emphysema is a condition in which there is permanent dilation of the air spaces distal to the terminal bronchiole. Now I have a separate video entirely on emphysema, so you can also look into that video after finishing this video for more information regarding emphysema. Moving on to the next type of cirrhosis, and that is cardiac cirrhosis. In this type of liver cirrhosis, there will be liver cirrhosis following severe right-sided heart failure. The causes will include cor pulmonale, tricuspid insufficiency, constrictive pericarditis, etc. In all these conditions, the pressure inside the right ventricle will be elevated, and this elevated pressure will be transferred into the liver through inferior vena cava and hepatic veins. So ultimately, this will lead to liver cirrhosis. And splenomegaly may be also seen in these cases, so always keep that thing in your mind too. The next type of liver cirrhosis is cirrhosis in autoimmune hepatitis. In this type of liver cirrhosis, we will see continuing hepatocyte necrosis, inflammation, and fibrosis that is ultimately leading to development of liver cirrhosis. The last type of liver cirrhosis that we will talk about is cryptogenic cirrhosis. Now, what do we mean by cryptogenic cirrhosis? The word crypto means concealed. So in this type of liver cirrhosis, we do not know the exact cause. So when all the possible causes of liver cirrhosis are excluded and we have not found any cause for the underlying liver cirrhosis, that is placed under this group, and that is cryptogenic liver cirrhosis. So now that we have defined and talked about the various classifications of liver cirrhosis, now we will move on and talk about the pathogenesis of liver cirrhosis. Now, in order to understand the pathogenesis of liver cirrhosis, we must have a clear conception about hepatic sinusoid and the structures surrounding it. So as you can see in the whiteboard, I have drawn a simplified image depicting hepatic sinusoid and the structures surrounding it. Note that the hepatic sinusoid is lined by endothelial cells, and there is a space between the lining endothelial cells and the underlying hepatocytes, and this space between the endothelial cells and the underlying hepatocytes is called the space of Deci. So this is the space of Deci, and we can see that there is a hepatic stellate cell in this space of Deci as shown in this image. Now always remember, these hepatic stellate cells will have a very important and vital role in the pathogenesis of liver cirrhosis, because these cells will be responsible for fibrosis. Now always remember, these hepatic stellate cells, when they are inactive, their function is to act as lipid storing cells. But whenever these cells get activated following liver injury, they will be transformed into myofibroblasts. Now note this term, myofibroblast. Since we have the term fibroblast in this word, so obviously these cells will be fibrogenic. They will result in fibrosis. At the same time, there is also the myo term in this word, so they will also have contractile properties. So always remember that the hepatic stellate cells will be transformed into their active form, and that will result in formation of myofibroblasts, and these activated cells will have contractile property, and also they will be fibrogenic, and that will result in fibrosis. So what are the stimuli that can activate an inactive hepatic stellate cell into its active form? They will include chronic inflammation. For example, in chronic inflammation, a variety of cytokines are released. For example, tumor necrosis factor, interleukin-1 beta, lymphotoxin. All these things may activate the hepatic stellate cells into their active form. Again, various chemical mediators may be released from Kupffer cells, endothelial cells, the hepatocytes, even from the epithelial cells lining the bile ducts, and all these chemical mediators will also activate the inactive hepatic stellate cell. Hepatic stellate cells can also be activated by direct toxin, and they can be also activated following destruction of the extracellular matrix components. So all these stimuli will activate the hepatic stellate cell, and that will transform this inactive hepatic stellate cell into its active form, and that will result in myofibroblast formation, and those myofibroblasts will result in fibrosis, and they will also have contractile properties. Now all these things are happening at a background of liver injury. So there is also hepatocyte death. Liver cells are dying either by apoptosis or via necrosis, and again liver is trying to compensate that by compensatory proliferation. So there is formation of regenerating nodules that are surrounded by fibrous septa, as we have seen in the definition. And now we know why there is fibrosis, and that is due to transformation of these inactive stellate cells into their active form, and that is the myofibroblast. So this was in short about the pathogenesis of liver cirrhosis. So this concludes part 1 of this series. I hope this video was helpful. I will hopefully upload the second part of liver cirrhosis within a week, where we will finish our discussion by talking about the morphology, clinical features, and management of this disease. Okay, so until next time, take care and stay blessed. Thank you.